歡迎大家出席今。
Welcome to the press briefing. Today we have on stage Dr. Chuang Chok-Kwan, Head Communicable Disease Branch of the Center for Health Protection, and Dr. Larry Lee, Chief Manager of the Hospital Authority. The two doctors will give you an update on the Hospital Authority and on the number of cases. First, Dr. Lee. Good afternoon. The Hospital Authority has a total of 2,139 confirmed patients in hospital. 310 are newly admitted patients, and among the patients in isolation facilities, 574 are in isolation wards, 174 are in second-tier isolation wards, 610 are in the North Lantau Hospital, Hong Kong Infection Control Center. 10 patients are now in the AWE treatment center, COVID treatment center, and there are a total of 227 new patients. As the epidemic remains serious, there are now over 2,600 patients in hospital, who are confirmed patients, and there are more and more who need to be hospitalized. The Hospital Authority has initiated the Stage 3 hospital bed deployment scheme. And yesterday we launched the AWE Treatment Center, and together with the North Lantau Hospital, Hong Kong Infection Control Center, we have 2,500 to 5,000 beds for patients now. I hope the public appreciate this. Well, the epidemic is not actually as mild as you think. Now, even though there are not many still in hospital, but actually the public hospital has to pay a high price now to treat these patients. We have to, it is done at the expense of other services. For example, we need to deploy staff to these facilities, and that's not an easy task. And many hospitals have already reduced non-emergency surgical procedures and other day treatment, and we will have to further cut down on other non-emergency services soon, because we will need more resources to take care of COVID patients. So other other medical services will have to be delayed, and so treatment will have to be delayed. Now we have already relaxed the relevant social distancing measures and other prevention control measures. Please, we need to stay vigilant. We must not let down our guard, especially if we are in crowded places. We have to pay attention to make sure we keep social distance and also observe infection control measures. If the epidemic becomes worse, the community as a whole will have to pay a high price, whether or not individuals are infected or not. And if you have not completed vaccination, please do so as soon as possible, because it takes time for your immunity to build up after vaccination. So you need to complete vaccination to give yourself and your family members protection. And if you're infected, even if the symptoms are mild, you have to seek medical treatment. Those who are age 60 or above and are in high-risk groups, they must take oral medication as soon as possible. That will reduce the risk of their condition worsening or even reducing the risk of death. And then yesterday, 2 patients were in critical condition. They had 5 patients were in critical condition. 2 had 3 jabs, 2 had 1 jab, 1 had no vaccination record, and then 12 are in serious condition. 43. There are 11 who are in ICUs now. And we are reporting 10 death cases, 6 males and 4 females aged between 69 to 105. Only 2 have completed 3 doses of vaccination. I'll briefly go through the cases. 3 of the patients, 2 were aged 99, 1 was aged 96. They all felt unwell at home, and they passed out, and then they were sent to the accident emergency department, and they could not be saved. And then the RAT result turned out positive for these 3 cases. Now for 2 of them, they did not have any vaccination record. 1 had 2 doses of vaccine. The 4th patient was a 90-year-old female who had 3 doses of vaccination. She had atrial fibrillation, and she had a history of stroke. And then on the 10th of August, she was admitted to hospital through the Eastern Hospital A&E department. And then 2 days before admission, on the 8th of August, her RAT result was positive. And then when she was admitted, her PCR result was also positive. CD value was 21. Her condition flip-flopped in a bit, and then she passed away on the 22nd. And then the fifth patient, 89-year-old male who had 2 doses of vaccine, he was in residential care home for some time. He had diabetes and heart disease, and then on the 19th of August he was admitted to hospital via the A&E of the Queen Elizabeth Hospital, and then his RAT test was positive, and his admission screening test was PCR test was also positive, and then his condition worsened on the 22nd of August. He passed away at around 3 a.m. The sixth patient, 82 male, no vaccination record. He had dementia. On the 10th of August, he was admitted directly to the Northland Hospital Hong Kong Infection Control Center. His X-ray showed that he had pneumonia, and he also needed oxygen supply. And as his condition worsened, he needed more oxygen. And then on the 22nd of August, he was found unconscious and he passed away. The seventh patient, 75-year male, year-old who had 3 doses of vaccine. He had hypertension and a history of heart problems. On the 10th of August, he did RAT and the result was positive, and he was admitted to the Northland Hospital Hong Kong Infection Control Center. While he was in hospital, his condition remained stable. On the 21st of August, he suffered fainting, dizziness a bit more, and we were worried that he might have had stroke, so he was sent to the Northland Hospital, and then there was some hemorrhage in the brain, and then he was admitted to Princess Margaret Hospital. But because of his brain condition, his health continues to worsen, and he passed away on the 22nd of August. It should have nothing to do with COVID. Another 18-year-old who had 2 male who had 2 jabs. He was admitted via A&E on the 21st of August after tripping, and his RAT result was negative, but then his admission PCR test was positive. And then from the scanning, we could see that he had signs of stroke, and then his condition continued to worsen. He was not much conscious, and then he passed away on the 22nd of August. Again, we believe that his death had nothing to do with COVID. The ninth patient, 69-year-old male with a history of terminal cancer. On the 16th of August, he was admitted via the Prince of Wales Hospital A&E department, and his X-ray showed some problems, and then his PCR test was positive for the first 2 days and then negative, and then afterwards. And then his cancer condition continues to worsen, and he passed away on the 22nd of August. The 10th patient, the last patient, a 105-year-old male who had no vaccination record. He had hypertension and renal failure, and he was admitted via the 19th Queen Mary Hospital on the 19th of August, and then on the 7th of August he tested RAT positive, and then X-ray showed pneumonia, also had atrial fibrillation, and then he was eventually transferred to the Fung Yue King Hospital because condition worsened, but then he passed away on the 22nd of August. In a past day, a total of 264 patients recovered. 26 patients were discharged among those, and then 13 patients were tested positive upon admission. 23 in the same water were listed as close contact. 145 patients of the staff members are newly confirmed cases ready to have returned to work. And I would like to report 2 new clusters. Tonghua Hospital, in Medicine Ward, a male patient was found to have contracted COVID after he had fever on the 18th and 19th of August, and the 3 patients are listed as a close contact. Some have been sent to the To Yua Group Hospital, Fung Yue King Hospital. The condition is stable. And then a hospital did test on staff members and found that 3 other staff members confirmed cases. Now, these staff members wore proper personal protective equipment, so we're trying to see if there's any link among these cases. And then Hypo Hospital at the orthopedic ward, an 85-year-old patient tested positive on the 21st of August. The hospital did contact tracing and found another 3 patients aged between 54 and 95 and 1 staff member who were infected. And then some of them had been sent to the Nadeso Hospital for isolation. The conditions remain stable. For the staff member, the staff member wore proper PPE at work, and so we're still trying to establish if there's any link among these cases. Thank you.
The positive cases yesterday, 6,410, 2192 through PCR, and 42818 through verified RAT, and 244 imported cases, 220 PCR, and 214 RAT. For the 244 imported cases, 125 were picked up at the airport, and day 1 to 3 quarantine hotel plus the quarantine centers. The number stands at 46. Day 4 to 7 from the community testing center, we picked up 25 cases. Day 8 to 14, there were 18 cases. Most of them have high CT value, possibly re-positive cases. For the 244 cases, they come from 48 places, 8 imported 10 or more than 10 cases, 32 US, 27 India, 20 Thailand, 18 the Philippines and the UK, 15 Canada and Singapore, 11 from Korea. And the other places imported 10 or less than 10 cases. In terms of fatalities, the HA reported additional 10 deceased cases. In the 5th wave, the fatalities, the total stands at 9,407. For care homes, RCHEs, yesterday there were 5 cases reported.路德會社會服務處路德會鳳德care home for the elderly. On the 22nd, 1 resident tested positive. 10 other residents have to be quarantined. And on the same floor, the staff members have also to be quarantined. Yang Hin in Kwai Ching Estate, 1 resident tested positive, and the neighboring residents have to be quarantined. Ga Tou Ge Hong Ji Ga in Tuen Mun, 2 staff members came down with COVID, and 5 residents are quarantined. YWCA Jing Ho Heng care home for the elderly, 1 resident tested positive, and 3 other residents have to be quarantined. Lekin home for the elderly in Northern District, 1 resident tested positive. There is another one today testing positive for the whole floor. There are 11 residents, and the other 7 have to be quarantined. Altogether 18 residents have to be quarantined. For schools, today there are 81 schools reporting 141 positive cases, 108 students and 33 staff members are involved. They come from 57 KG come CCC, 10 primary and 13 secondary and 1 special schools. Over the past 7 days, there are 27 schools that reported 2 or more cases. Today, we have advised a number of schools to suspend some of the classes for a week. Being our kindergarten in Kowloon City, T1, 25 toddlers, and they've already started the holiday yesterday, but Yesterday, they reported 9 students plus 3 teachers who came down with COVID. And for the other 15 pupils and the teachers and staff members have to be quarantined. Ying Ai Kindergarten in Yunlong N1A, 23 pupils. Progressively, there are 7 pupils who tested positive over the past couple of days. The class has to be suspended 1 week. Lai Yin Wei, Ying Yi Yun in Yunlong, a number of classes saw infection, Daizhou, Zhongzhou, and Saizhou B. 6 for the big group, 12 for the middle group, and small group 5. And for these 3 classes, there are 2 students testing positive each, and these 3 classes, or these 5 classes rather, consist of 64 pupils, and there are cases in 3 of them, and some of the pupils have to be suspended for the time being. Catholic Singbolo Kindergarten N4C, 16 pupils, 2 test positive, suspended for a week. Yesterday, we reported a Hip Hong Society, Fucheng Zhongsam, Holland class, 13 students testing positive. This is a special childcare center. There is another one, the England class, 12 students, 1 teacher testing positive, and 1 more student testing positive. In this special childcare center, there are 3 classes consisting of 43 students. There are 4 students who tested positive, plus 1 teacher. For these 3 classes, we advised them to be suspended for a week. In terms of subvariant, the trend is going up. From the specimen we collected, BA4, BA5, it has increased to 37.1%, BA2 12.1%. It is around about 9%. That's all I have to say for the time being. It's now time for questions. Please identify the organization you represent, and please wait for the mic. The gentleman in gray, please. TVB. The BA.5, it's gone up to 37.1%. Some experts said that when the percentage hit 35%, the number of cases can hit 10,000. How do you view these kind of comments? In AWE, there are more patients being admitted. Will there be more sent to the AWE going forward? Now, for the care homes, there seems to be some outbreaks in some of them. Are you going to mandate the staff members to be tested twice a week? BA.4 and BA.5. Yesterday, the single day number on the 20th, it was it is 37%. The PH lab has analyzed the BA.5 specimen from August 15 and 21st. Now for this week, BA.4, it is 12%, BA.5 around about 88%. So for L452R, BA.5, they take up the vast majority of the cases. The WHO has witnessed BA.5 is surging past other kinds of subvariants. It seems that this is also a consistent trend in Hong Kong. And this is well within our expectations, and this is also commensurate with other parts of the world. And given the situation, and I urge those who are not vaccinated up to the 3rd shot should get vaccinated fully. For BA.4, BA.5 in particular, this is an Omicron subvariant, and the two-jab immunity may not be as effective against BA.5 as the previous subvariants, but with the third shot, things will be improved. Now, this is a booster and this is going to be increasing the immunity against the subvariant. In particular, this will protect against severe cases. For those who are under-vaccinated, they should get a third shot as soon as possible. For the AWE center, there are 10 patients as of 9 a.m. this morning. There are progressively going to be patients being transferred there, and definitely the number will be beyond 10. There are 200 beds. As I said, there are 3 ways we admit patients from hospital, from the community, and also from the community isolation facilities. So we do have plans to progressively admit more patients there. We do have a tacit understanding with the different hospital clusters, and more patients will be sent there to alleviate the burden on the hospitals. There is an impending typhoon, and we hope that tomorrow there will be more patients that will be sent to the AWE and also Atlanta Hospital ICC. Next, please.
Are there other questions? On the left, the last row in the middle, please. Yes, I'm from AM730 about residential care homes. The first one, Lutheran Church, Fongtac. You say the staff on the same floor have to be quarantined. How many staff members are involved? And what are their duties, and what sort of contact did they have with the infected? Why is it that they have to be quarantined? Now, you say 10 residents. Do you mean all residents are on the same floor? And then kindergarten, 5 student pupils and 10 teachers have to be quarantined. So what is the cause of transmission? Why is it that not the whole class is sent to quarantine? And what about the occupancy rate of isolation beds? You say some non-emergency services have to be suspended. So how many people are affected? Do you have an initial estimate? Have they been informed? Can you tell us what kinds of patients they are? Sorry, I put it wrongly. For staff on the same floor, they have to be tested. Quarantine only involves 10. Residents on the same floor. As for staff members, they just need to be tested. For kindergarten, it's also childcare center. So during the summer, the center is open, and because there are some half-day classes, they started to go on vacation on the 10th of August, and then for full-day classes, they went on summer leave on the 22nd of August. So therefore, these young children, some of them did not wear masks. That's why there are more who have become infected, so it's an outbreak. That's why many of the pupils and staff members have to be quarantined. For the hospital authority, we have about 2,200 beds. As I mentioned, we've initiated stage 3 of bed deployment scheme, so we will be increasing more beds. Now there are some 2,000 patients, in our hospitals, and also the North Lantau Hospital, Hong Kong Infection Control Center, as well as the AWE COVID-19 Treatment Center. Your second question, sorry, what was it? Yes. Of course, for non-emergency services, we can't tell you exactly what sort of services have been suspended, because it depends on different hospitals in different clusters. But of course, mostly we're talking about non-emergency surgeries or examination. And if you really want a figure, then roughly it's about 20% of our services. Next, on the right, far back. I'm from cable TV. There are designated taxis that have taken on other passengers. So is there a loophole in infection control? And if there are just members of the public, taking these designated taxis, what is the risk? Do you have any assessment? I understand the Transport and Logistics Bureau will be followed up on the case, and you could ask them for the details. They will take this case most seriously. I'm from Ming Pao. For stage 3 bed redeployment scheme, Dr. Lee said there will be 2,500 to 5,000 beds. What is the percentage? How many beds in the Northland Hospital, how many in the AWE Center, and which public hospitals will see their beds redeployed for COVID purposes first? Now you say there will be delay to non-COVID services. So on average, what is the length of delay? And then you said you have it's done at the expense of many other measures. So would there be any improvement measures to relieve the burden on public hospitals? In the past week, for those aged between 3 and 11 and those about 80, there has been a surge in cases involving this age group. So what is your assessment onto why, as to why that's the case? For stage 3 bed redeployment, we could look at the different levels. Now, for hospital beds, in phase 2, we want to redeploy 2,500 beds, and in phase 3, we will gradually get to the figure of 4,000 beds. For North Lantau Hospital, Hong Kong Infection Control Center, there are 800 beds. All these beds are now used for COVID patients. As for the AWE Treatment Center, we will first start with 200 beds. At halls 8 and 10 of the AWE, Asia World Expo, that is, there will be another 500 beds in reserve. So we could increase the number of beds, but then that means we will need to deploy more manpower there. And that means there will be further impact on normal services. Now, what is the impact on our services? Well, honestly, I can't give you a figure. But then the hospital authority does not want to see patient services being affected. In particular, we don't want to affect the treatment of non-COVID patients. So we try to do the best we could. As for patients in home isolation, we'd like to bring an appeal, especially for the elderly. Even if their symptoms are mild, they could go to designated clinics in person, or they could use our teleconsultation service. This is to make sure that they will receive the appropriate treatment, and they could get the oral medications as soon as possible. Now, for the age group 0 to 2, the last week and 2 or 3 weeks before, if you compare to those periods, and it's gone up slightly, 1.8% now, and 2 weeks ago it was 1.6%. So the age group 3 to 9, it was 5.6%, now it's 5.5%, so there's not much increase. The age group 10 to 19, it was 7.4% before and 7.5% now. We will take an English question. It's the second last row, the lady in green.
THK, how the virus at May Kindergarten was transmitted, and can Dr. Lee explain more about the heavy price people have to pay, infected or not?
Do you mind you repeat your second question? I can't really cap what you're asking about.
Can you explain more about the heavy price people have to pay, infected or not?
I'm not sure about your questions. Rephrase in a...
the people that are infected or not infected. So, can you explain more about the heavy price?
Oh, the heavy price.
Yeah.
Okay. Now, because for the hospital and also for the Tier 3, the community facility, for the hospital, we have a fixed number of the hospital bed, and now we have to mobilize some more bed to handle the COVID situations. And actually, these beds in the past, we can handle the non-COVID cases, including all the patients coming through the community or maybe coming through the accident and emergency department. And actually, this is one of our limitations. The other limitations is about the support of the community facility, including the Hong Kong ICC, including the AWE. We have the hardware there, and actually we can mobilize more bed or maybe mobilize more cases there. But the difficulty for ourselves is about the manpower. The manpower, we need to stop some non-emergency service or maybe even some more clinical service so that we can mobilize the cases and also mobilize the staff there. And these two limitations leading to the fact that we have to significantly to stop some services so that we can make the necessary deployment of the hardware and also the manpower. And I think this is the situation we want to explain.
下一位，右手邊。
The gentleman on the right, please. Now TV. Now for the 3 cases that passed out and were sent to the hospital and died there, what was the CT value? Were they prescribed any antivirals? Were they chronically ill patients? Did they die of COVID? And also for CHP, now there are more and more staff members who are infected with COVID. Would you increase the number of PCR tests and would you try to ascertain the sources of infection? Right, let me take the questions first. We understand that we are considering whether we should increase the number of tests on the part of the staff members. Now, you mentioned the 3 cases. They were unconscious at home, and they were sent to the A&E by ambulance, and they were resuscitated. And normally, we would administer a PCR test on them. We would report the positive cases. Or we would conduct a RAT test. That we don't conduct the PCR test. So we don't have the CT value. They are chronically ill patients. According to record, one of the patients had fever and shortness of breath. For the other 2, we didn't have any clinical information at all. Let's make it the last question. The one on the left, please. Economic Times. The one in Yuen Long, the school, Lai Yin Hui School in Yuen Long, there are 5 classes that have to be suspended. Why is it that 2 that didn't have any cases have to be suspended as well? And for the 3rd stage of your plan, how many more patients can you accommodate, and how soon are you going to have activate the 4th stage? Are you going to be opening the designated hospitals? Now, will there be any plans to offer leave for parents who accompany their children for vaccination? Now, for this Yuen Long school, there are cases in 3 classes. The total number stands at 60, and there are 6 children or 5 children and a teacher who will test positive. And there seems to be some sign of transmission in the school, so it's advisable to suspend the classes. We're entering the 3rd stage, and this is a very massive program. We have double the number of beds. We also have opened the AWE. We anticipate that we should have double the capacity to cope with the situation, so we can cope with 300 admissions on a daily basis. However, the number can be increased to 600. Now, this is only an indicative number. On different days, there can be variations. You asked me about the situation. In our contingency plan, we do have the stage 4 plan in which more beds will be deployed, and we also have the idea of designated hospitals as well. You mentioned the half-day leave for accompanying children for vaccination. The HR is considering this. We will make the announcement in due course. That's it for today. Thank you all very much.